Bilkul. Nietzsche ***, 9 hidden signs of vitamin B12 deficiency after 65. Kalia, long form, original YouTube script, Daya Gaya Hai. Main Kisi specific YouTube channel key exact wording ya distinctive style copy nahi ka raha. Lekin script ko simple, human, conversational, senior friendly, engaging health video format mine raka hai. Number 9. Hidden signs of vitamin B12 deficiency after 65. Number 5,000 word YouTube script, opening hook, Have you been feeling more tired lately? Maybe your legs feel weak. Maybe you sometimes feel a strange tingling in your hands or feet. Perhaps your memory isn't quite as sharp as it used to be. Or maybe you simply feel like you're getting older faster than you expected. Now here's something important. After the age of 65, some symptoms that we casually blame on aging may actually have another explanation. And one of those possibilities is vitamin B12 deficiency Vitamin B12 is a small nutrient, but your body depends on it for some very important jobs. It helps support healthy red blood cells, normal nerve function, and DNA production. The tricky part is that B12 deficiency doesn't always announce itself with one obvious symptom. Instead, it can develop slowly. You may notice a little fatigue, then some numbness, then balance problems, then changes in memory or concentration. And because these symptoms can look like ordinary signs of getting older, they can easily be overlooked. Today we're going to talk about **9 hidden signs of vitamin B12 deficiency that adults over 65 should know about. But before we begin, there's one important point. Having one or even several of these symptoms does not automatically mean you have a B12 deficiency. There are many possible causes for tiredness, numbness, weakness, or memory changes. The only way to know what's really happening is to speak with your healthcare professional and, when appropriate, have the proper blood tests. So think of today's video as a guide to help you recognize something that may deserve a closer look. And stay with me until the end, because I'll also explain who is more likely to become B12 deficient after 65, why age can change the way your body absorbs B12, and what you can do if you're concerned about your levels. Let's get started. Number 1. Unexplained tiredness. Let's begin with one of the most common symptoms. Fatigue. Not simply feeling sleepy after a busy day. I'm talking about a deeper feeling of low energy. You wake up after what seemed like a reasonable night's sleep, but you still don't feel refreshed. You get dressed, you make breakfast, you do a few things around the house, and suddenly you think, why am I already exhausted? This is something many older adults simply accept. They say, well, I'm over 65. Of course I'm tired. But don't automatically assume that. Vitamin B12 is involved in the production of healthy red blood cells. When someone has significant B12 deficiency, they can develop a type of anemia called megaloblastic anemia, And anemia can contribute to tiredness, weakness, and shortness of breath. But here's the important part. Fatigue has dozens of possible causes. Poor sleep, medication side effects, thyroid problems, anemia from other causes, heart or lung conditions, depression, infections, not eating enough, and many others. So fatigue alone doesn't tell you that B12 is the problem. But if your tiredness is new, persistent, or getting worse, don't simply write it off as aging, especially if it comes with other symptoms on today's list. That's when it becomes worth talking to your healthcare professional. Number 2, tingling or numbness in your hands and feet. Now this one deserves special attention. Have you ever experienced that strange sensation where your feet feel like they're asleep? Maybe there's a little tingling, a buzzing feeling, pins and needles, or even reduced sensation. Sometimes it happens in the hands, sometimes the feet, and sometimes both. People often say, it's probably just circulation, but there can be several explanations. B12 is important for maintaining normal nerve function. When B12 deficiency becomes significant, neurological problems can develop. These may include numbness, tingling, weakness, or difficulty walking. And this is one reason B12 deficiency shouldn't be ignored, because neurological symptoms can sometimes occur even without obvious anemia. In other words, you don't necessarily have to feel extremely tired before nerve-related symptoms appear. Imagine someone who says, "My feet feel strange when I walk." They may describe a burning sensation, or tingling, or feeling as if they're walking on something soft. Sometimes they may even say, "I can feel my feet, but they don't feel normal." That deserves attention. And there's another reason this matters after 65. Balance becomes increasingly important as we age. If sensation in your feet becomes impaired, it can become harder to know exactly where your feet are when walking. That can potentially contribute to instability and falls. So, if you've developed unexplained numbness or tingling, especially if it's persistent or worsening, talk with your healthcare professional. Don't assume it's simply part of getting older. Sign number 3, balance problems or walking differently. Here's a symptom that many people don't connect with nutrition. Balance problems. Maybe you've started holding on to furniture when walking around the house. Maybe stairs don't feel as comfortable as they used to. Maybe you feel slightly unsteady when getting up at night. Or perhaps someone in your family has noticed that you're walking differently. Now, balance problems can have many causes. Vision changes, inner ear problems, muscle weakness, certain medications, blood pressure changes, neurological conditions, joint problems, and more. But significant B12 deficiency can also affect the nervous system. That's why a new change in walking or balance shouldn't simply be dismissed. Think about it this way. Your brain needs information from your eyes, muscles, joints, and nerves to help you stay balanced. If nerve function is impaired, that communication can become less reliable. You might feel unsteady. You might have difficulty knowing where your feet are. You may feel more cautious while walking. And sometimes the change happens so gradually that you don't notice it immediately. Your family might notice it first. So if someone tells you, "You don't seem as steady as you used to be," don't automatically brush it off. Pay attention. And if you've also noticed numbness or tingling in your feet, that's even more reason to discuss it with your doctor. Sign number 4, memory or concentration changes. Now let's talk about something that worries many people. Memory. Forgetting someone's name occasionally is normal. Walking into a room and forgetting why you went there can happen to almost anyone. But what if you start noticing a broader change? You have trouble concentrating. You feel mentally foggy. You struggle to follow conversations. You forget things more frequently. Or you feel like your thinking isn't as clear as it used to be. Again, there are many possible causes. Stress, poor sleep, depression, medication effects, thyroid problems, certain neurological conditions, and normal age-related changes. But B12 deficiency can also affect the nervous system and may be associated with cognitive or mood changes. This is why healthcare professionals sometimes consider vitamin deficiencies when evaluating unexplained cognitive symptoms. Now, I want to make something very clear. If someone has memory problems, that does not mean they have B12 deficiency. And B12 treatment is not a universal treatment for dementia. That's an important distinction. But if a person is actually deficient, identifying and treating the deficiency is important. So don't panic if you've recently forgotten a few things. Instead, look at the bigger picture. Are your memory changes new? Are they becoming more frequent? Are they interfering with everyday life? Are there other symptoms such as numbness, weakness, fatigue, or balance problems? If yes, it's worth having a conversation with your healthcare professional. Sign number 5, muscle weakness. Here's another symptom that can sneak up on you. Weakness. Maybe you used to get out of your chair easily. Now you need to push off with your hands. Maybe climbing stairs has become noticeably harder. Maybe carrying groceries feels more difficult. Or perhaps your legs simply don't feel as strong as they used to. Now, muscle loss is common with aging, especially when people become less physically active. But weakness should still be taken seriously. B12 deficiency can cause neurological problems that may contribute to weakness. And when weakness occurs alongside numbness or balance problems, it becomes especially important to get evaluated. But don't immediately reach for a B12 supplement and assume you've solved the problem. Weakness can come from many conditions. Low vitamin D, low iron, thyroid problems, poor nutrition, dehydration, medication effects, muscle loss, heart disease, neurological conditions, and many others. The goal isn't to guess. The goal is to identify the cause. That's why medical evaluation matters. Sign number 6, a swollen or sore tongue. Now here's a symptom that people often don't think about: your tongue. Vitamin B12 deficiency can sometimes cause changes in the mouth, including a sore or inflamed tongue. You might notice that your tongue feels unusually sensitive. Perhaps it looks smoother or redder than normal. Maybe eating spicy foods suddenly becomes uncomfortable, or you feel a burning sensation in your mouth. Some people may also experience mouth sores or changes in taste. And because these symptoms can seem unrelated to the rest of the body, people may not connect them with nutrition. Think about how easy it is to say, it's probably just something I ate. And maybe it is. But if the problem persists, it's worth getting checked, especially if you're also experiencing fatigue, numbness, weakness, or other symptoms. Your mouth can sometimes provide clues about what's happening elsewhere in your body. Sign number 7, mood changes. Let's talk about something that isn't always discussed enough. Mood. Have you recently felt more irritable, more down than usual, less interested in activities you normally enjoy, or simply not quite like yourself? Mood changes have many possible causes: life changes, loneliness, stress, poor sleep, medication effects, chronic illness, and depression itself. But vitamin B12 plays an important role in normal nervous system function, and deficiency can be associated with neurological and psychological symptoms. That doesn't mean B12 is the cause of every mood change. It isn't. But if mood changes appear together with physical symptoms, such as numbness, weakness, fatigue, or balance problems, it's worth mentioning all of them to your healthcare professional. Don't just tell your doctor, "I'm tired." Give them the complete picture. Say, "I'm tired, my feet are tingling, I've been feeling weaker, and I've noticed changes in my mood." Those details can help your healthcare professional decide what needs to be investigated. Sign number 8, pale or yellowish skin. Here's another possible clue: changes in your skin color. Some people with significant B12 deficiency and associated anemia may appear unusually pale. In some cases, the skin can have a slightly yellowish appearance because of changes associated with red blood cell breakdown. But once again, don't diagnose yourself based on appearance. Skin color can change for many reasons. Lighting can make a huge difference. Dehydration can affect how you look. Other types of anemia can cause paleness. Liver and blood disorders can cause yellowing, and many other conditions can affect skin color. So, if you notice a significant or persistent change, especially if it's accompanied by fatigue, weakness, shortness of breath, dizziness, or other concerning symptoms, get medical advice. The important lesson is this: your body often gives you small clues. You don't need to panic over every clue, but you shouldn't ignore persistent changes either. Number 9, shortness of breath or a fast heartbeat with activity. Now let's discuss a symptom that can be easy to overlook. You walk to the mailbox, you climb a few stairs, you carry something across the house, and suddenly your heart seems to be beating harder than expected. Maybe you become short of breath. Maybe you feel unusually weak. If significant B12 deficiency causes anemia, the body's ability to carry oxygen can be affected. That can contribute to fatigue, weakness, shortness of breath, or a faster heartbeat, particularly during physical activity. But this symptom needs extra caution, because shortness of breath and chest symptoms can also be signs of heart or lung problems. So don't assume, "Oh, I must be low in B12. If you're having unexplained or significant shortness of breath, chest pain, fainting, severe weakness, or a rapid or irregular heartbeat, seek appropriate medical attention promptly. The point isn't to frighten you, it's to make sure you don't blame a potentially serious symptom on a vitamin deficiency without being evaluated. Why does B12 deficiency become more important after 65? Now you may be wondering, why are older adults sometimes more vulnerable to B12 deficiency? One important reason is that the way your digestive system handles B12 can change. Vitamin B12 naturally occurs in foods such as fish, meat, poultry, eggs, and dairy products. But getting B12 from food is only part of the story. Your body has to absorb it. And B12 absorption is a complicated process involving stomach acid and a substance called asterisk intrinsic factor, asterisk. As people age, some may develop conditions or changes that interfere with absorption. Certain medications can also affect B12 status. For example, long-term use of some acid-reducing medications can be associated with reduced B12 absorption. Metformin, a medication commonly used for type 2 diabetes, can also reduce B12 levels in some people over time. That doesn't mean you should stop any medication. Absolutely not. If you take medication regularly, don't change your dose or stop taking it because of something you heard in a YouTube video. Instead, ask your healthcare professional whether your medications could affect B12 status and whether testing is appropriate. Number, WHO may be at greater risk. Let's quickly go through some groups who may be more likely to develop B12 deficiency. Older adults are one group. People with certain digestive conditions may also be at increased risk. People who have undergone certain stomach or intestinal surgeries may have difficulty absorbing B12. People with conditions affecting the stomach or small intestine may also be at higher risk. And people following strict vegan diets may need to pay particular attention because naturally occurring B12 is primarily found in animal-derived foods. Some fortified foods and supplements can provide B12, but dietary choices should be discussed in the context of your individual nutritional needs. And again, don't assume that because you're vegetarian or vegan, you definitely have a deficiency. You may not. Testing can provide a clearer answer. Number, why you shouldn't just guess. This is an important section. You might hear all of these symptoms and think, that's me, I need B12 immediately. Maybe, but maybe not. The problem is that symptoms of B12 deficiency overlap with many other conditions. Fatigue can be caused by dozens of things. Numbness can have many causes. Memory problems can have many causes. Weakness can have many causes. That's why testing and medical evaluation matter. Your healthcare professional may consider a complete blood count and a vitamin B12 level, along with other tests depending on your symptoms and medical history. Sometimes, additional testing is needed when the B12 result isn't straightforward. The exact approach depends on the person. That's why a good evaluation is much better than internet guessing. Number, can you get enough B12 from food? For many people, food can provide plenty of B12. Good dietary sources include fish, meat, poultry, eggs, milk, yogurt, cheese. Some fortified breakfast cereals and other fortified foods can also contain B12. But remember something important. A person can eat foods containing B12 and still develop a deficiency if their body isn't absorbing it properly. That's why simply saying, I eat meat, so I can't be deficient, isn't necessarily correct. Absorption matters. Age matters. Medical history matters. Medications matter. And individual circumstances matter. Number, should you take a B12 supplement? This is one of the first questions people ask. And the answer is asterisk, asterisk. It depends. Asterisk, asterisk. Vitamin B12 supplements are widely available, and B12 has a strong safety profile at typical supplemental doses. But the best approach depends on why your B12 is low, how low it is, whether you have symptoms, and whether you have an absorption problem. Some people may need oral supplementation. Others may require a different treatment approach depending on the underlying cause. And some people don't need supplementation at all. So don't think of today's video as everyone over 65 should take B12. That's not what we're saying. The message is much simpler. Asterisk, asterisk, know the signs, know your risk, and get checked when appropriate. Asterisk, asterisk, number the biggest mistake people make. One of the biggest mistakes is assuming that every new symptom is simply aging. You say, I'm tired because I'm older. My feet tingle because I'm older. My balance isn't as good because I'm older. My memory isn't as sharp because I'm older. Sometimes aging really is part of the explanation. But sometimes there's a treatable medical or nutritional problem hiding underneath. And that's why paying attention to changes matters. Aging doesn't mean you should stop asking questions about your health. In fact, the opposite is true. The more years you have behind you, the more valuable it becomes to understand what's normal for you and what's changed. Number A, simple way to think about your symptoms. Here's something you can do. Don't focus on one symptom. Look at the asterisk, asterisk, pattern, asterisk, asterisk. For example, are you unusually tired? Do you have tingling in your feet? Have you noticed weakness? Are you having balance problems? Have you noticed changes in concentration? Is your tongue sore? Are there changes in your mood? Are you experiencing shortness of breath with activity? One symptom doesn't prove anything, but a combination of symptoms deserves a conversation with your healthcare professional. And write them down. This is surprisingly helpful. Before your appointment, make a short list. When did the symptom begin? Has it gotten worse? Is it constant or occasional? What medications and supplements do you take? What does your typical diet look like? Have you had stomach or intestinal problems? Have you had previous blood tests? These details can help your healthcare professional understand the bigger picture. Number. Don't forget your medications. After 65, many people take several medications, and medications can be very important. They can control blood pressure, manage diabetes, protect the heart, reduce pain, treat reflux, and help manage many other conditions. But some medications can affect nutrient absorption or nutrient levels. This is one reason medication reviews are so important. At your next appointment, ask, could any of my medications affect my B12 level? You don't need to stop anything. You simply need to ask. That's a much safer approach than changing medication on your own. Number. When should you take symptoms seriously? Let's make this practical. If you're experiencing mild fatigue once in a while, that's different from persistent fatigue that interferes with daily life. If you occasionally forget a name, that's different from significant memory changes affecting your ability to manage everyday tasks. If your foot falls asleep after sitting awkwardly, that's different from persistent numbness or tingling. If you're slightly tired after climbing several flights of stairs, that's different from becoming unexpectedly short of breath during ordinary activities. The *** pattern, severity, duration, and combination of symptoms. *** matter, and if symptoms are new or worsening, get them evaluated. Number. What can you do today? Let's finish with some simple steps. ***, Step 1. Pay attention to changes. ***, don't obsess over every sensation, but don't ignore persistent changes either. Step 2. Look at your diet. Are you regularly eating B12 containing foods? If not, talk with a healthcare professional or qualified dietitian about your nutritional needs. Step 3. Review your medications. Especially if you take medications long term. Ask whether they could affect B12. Step 4. Ask whether testing makes sense. A simple blood test can often provide useful information. Your healthcare professional can decide which tests are appropriate. Step 5. Don't self-diagnose. You may have B12 deficiency, but you may have something else. The goal is to find the actual cause. Number. The 9 signs again. Before we end, let's quickly review the 9 possible warning signs we've discussed. Number 1. Unexplained or persistent fatigue. Number 2. Tingling or numbness in your hands or feet. Number 3. Balance problems or changes in walking. Number 4. Memory or concentration changes. Number 5. Muscle weakness. Number 6. A sore, swollen, or unusually smooth tongue or other mouth changes. Number 7. Mood changes. Number 8. Unusual paleness or yellowish skin changes. And number 9. Shortness of breath or a faster heartbeat with activity, particularly when anemia is present. Again, none of these symptoms alone proves B12 deficiency. That's very important. But if you're experiencing several of them, especially new neurological symptoms like numbness, tingling, weakness, or balance problems, it's worth discussing them with your healthcare professional. Final message. Getting older doesn't mean you have to accept every uncomfortable change as inevitable. Your body is constantly giving you information. Sometimes it's something simple. Sometimes it's a nutritional issue. Sometimes it's a medication effect. Sometimes it's a medical condition that needs attention. And sometimes it's simply part of normal aging. The key is knowing the difference. Vitamin B12 is just one piece of that puzzle. You don't need to panic. You don't need to start taking handfuls of supplements. And you certainly don't need to believe every health claim you see online. Instead, become your own health detective. Notice changes, write them down, ask questions, get appropriate tests, and work with your healthcare professional to understand what your body is actually telling you. Because after 65, one of the best things you can do for yourself isn't chasing every new health trend. It's paying attention And sometimes, something as simple as checking a vitamin level can uncover a problem that is much easier to address when you find it early. So if you've noticed unusual fatigue, persistent tingling, balance problems, weakness, or changes in memory, don't automatically say, that's just my age. Ask yourself one better question. Asterisk, asterisk. Could there be something else going on? Asterisk, asterisk. That simple question could be worth asking. Asterisk, asterisk. Call to action. Asterisk, asterisk. If you found this information useful, share this video with someone over 65 who might benefit from it. And in the comments tell us, asterisk, asterisk, which of these signs surprised you the most? Asterisk, asterisk, was it the tingling, the balance changes, the fatigue, or the memory and concentration problems? Remember, this video is for general educational information and is not a diagnosis or a substitute for medical care. If you're concerned about symptoms or vitamin B12 levels, speak with your doctor or another qualified healthcare professional. Take care of yourself, keep learning about your health, and remember, asterisk, asterisk, small changes are worth paying attention to. Asterisk, asterisk, and sometimes the earlier you ask the right question, the more options you have to address the problem. Asterisk, asterisk, and asterisk, asterisk.